Alright, welcome back everybody. Now let's have a look at some of the features of the nasal cavity. In this case, we're going to be looking at the blood supply and the innervation. To gain access to the view of the nasal cavity, what I've done is I've removed all of the left half of the head. That means I actually had to hide half of the brain and half of the maxilla and mandible and so on and so forth. And after clicking around and hiding all these structures, now we can very nicely see that the nasal septum has a dual supply. With dual, I mean it has basically paired arteries on the left and right side and paired nerves on the left and right side. Right? So what I've done is I've actually faded the cartilage and the bones that contribute to the formation of the nasal septum so that it illustrates a little bit better that we actually have these pairs of arteries and nerves running on either side of the septum. So in lab, what many people do is they would actually go ahead and remove all the bones of the nasal cavity. I'll see if I can highlight this again here. See, there's the ethmoid bone. If I put it back, I can do the same thing with our vomer down here. I can unfade that. So now you can actually see, apart from the cartilage, I've added in the bones again. Okay, so I'm going to go ahead and fade these parts again. Okay, so now you can really see that these are paired structures we're dealing with. And basically, in a nutshell, we could say that the arterial supply to the nasal cavity is largely from the sphenopalatine artery and the anterior and posterior ethmoidal arteries. In addition to that, also an artery called the greater palatine artery, which will be coursing down here, contributes to the supply of the nasal cavity. And last but not least, also the superior labial artery and the lateral nasal branches of the facial artery all help in supplying the lateral and medial walls of the nasal cavity with blood. So now I'm going to go ahead and hide the arteries on the left side and the nerves, and I'm going to take away the cartilaginous and bony structures of the nasal septum. So now we can see here this nerve, which is your nasopalatine nerve. And we're actually seeing the one from the right side, as it is going to be running deep to the bone that I just removed. Okay, so oftentimes in lab you're going to have to actually strip away the mucosa and the bones from the side that is facing you so that you're left only with the remaining mucosa on the right side of the septum. The nasopalatine nerve, which is really tiny. The nasopalatine nerve will then travel down here inferiorly, and it'll terminate by poking through this little hole, this little foramen here, called the incisive foramen. Quite logically called the incisive foramen because it is right there where the incisor teeth are. And go back out, put this into context. And the nasopalatine nerve is going to be a branch of the maxillary division of the trigeminal nerve, so a branch of V2. In addition to that, there are some more smaller branches that may not be shown here. These would also be branches of V2. They're called posterior, superior, and posterior inferior lateral nasal branches of V2. You can see up here, actually I've removed the olfactory bulb on the left side. Here's the olfactory bulb on the right side. You can see these little axons, or these little nerve endings that are being pushed through there. I've removed the cribriform plate, which is the sieve-like plate through which these extensions are poking through that help us smell, right? If you have a fracture of the cribriform plate, you might actually suffer from anosmia, which is the loss of the ability to perceive odorants, so smells. So I'm going to go ahead and remove all the mucosa that lines the nasal cavity. So everything that lines the septum, but also what lines the three conchae. Down here is our inferior concha. Okay, so I'm going to hide this. And now we are left with just the arterial and the nerve supply of the nasal cavity, right? So here we can see the course of your right nasopalatine nerve. And this supplies approximately the posterior-inferior two halves of the nasal septum. And down here, there are some posterolateral branches or posterior-inferior branches of the greater palatine nerve that supply the lateral wall of the nasal cavity. See, the rest of the greater palatine nerve will come out of the greater palatine foramen down here and supply the hard palate all the way up here until it nearly bumps into the nasopalatine nerve. Now, revisiting the arterial supply of the medial and lateral walls of the nasal cavity, well, I have already mentioned that this is mainly from the sphenopalatine artery and the anterior and posterior ethmoidal arteries, in addition to the greater palatine artery, which will run a similar course to the greater palatine nerve, which we've already discussed, and the superior labial and lateral nasal branches of the facial artery. So here we can see the septal branches of our sphenopalatine artery. If we follow the sphenopalatine artery posteriorly, we can see here we are at the point where it just receives its name, sphenopalatine artery, as it passes through the sphenopalatine foramen. Remember that if you're looking at this from laterally, we have to dive all the way deep here and see that the sphenopalatine artery actually comes from the maxillary artery in the pterygopalatine fossa. Now we can see a very dense anastomotic network of the posterior lateral nasal arteries, which are also branches of the sphenopalatine artery. We have here branches of the anterior ethmoidal artery, which are anterior septal branches. And here are the posterior lateral nasal arteries from the right side. So the arterial network that we see is quite important, because I'm sure that you have heard of people who have frequent and, at times, concerningly heavy nosebleeds, right? Well, this is a very vascular area, isn't it? And especially on the slightly more anterior part of the nasal septum, the area is going to be called the Kieselbach area, which is just descriptive of an area that is very rich in capillaries, where all of the 5 arteries that supply the septum anastomose with each other. So this is going to be the most frequently associated area with profuse nosebleeds. And you will have noticed that, again, I have completely neglected the veins, just for simplicity, as the veins very often will just parallel the course of the arteries. I can add in all the veins here, and you can now probably understand why I chose to omit the veins. In the nasal cavity, we have a very rich plexus of veins that will drain deep to the nasal mucosa into the sphenopalatine, facial, and ophthalmic veins. And so now, not to confuse you, but just to highlight how many different arteries and nerves we have that supply the nasal cavity, I've added in a couple of the labels you can see here now. You can visit that within the software on the appropriate screen within the module for the nasal cavity. So you can see here is the anterior lateral branch of the ethmoidal artery. You have anterior septal branches. You have posterior lateral nasal branches. You have the anterior ethmoidal artery, which is a branch of the ophthalmic artery. Then you have the sphenopalatine artery. Shortly after it comes through the sphenopalatine foramen, it's opening down here. After that, you will then have your posterior septal branches of the sphenopalatine artery, and you're going to have a lesser palatine artery, lesser palatine nerves, greater palatine artery, greater palatine nerves, and then the nasopalatine nerve, which is going to be right here. And you're going to have posterior superior lateral branches of V2, and of course posterior inferior branches of the greater palatine nerve, also from V2.